island of Taiwan, the streets are bustling. Restaurants are open for diners. Schools only shut down for 2 weeks in February. And even the baseball season is in full swing. Though one team temporarily relied on mannequin spectators. With a population of nearly 24 million, Taiwan's had just 7 deaths, and with rapid contact tracing fewer than 500 infections. And that's despite lying around 80 miles from mainland China.
We have been planning for any kind of pandemic that may affect Taiwan. And the reason is because back in 2003, Taiwan was hit very hard by SARS.
So let me get this straight. You had been planning for a pandemic for 17 years?
Yes, and it will not stop.
They already had a command center ready to activate and generous stockpiles of protective gear. And Taiwanese companies invested in high-tech solutions like these robot testing machines. Crucially, the government started warning the public of how serious the new virus was back in January. The health minister even broke down in tears as he announced a new infection.
It appears like we were caught sort of with our pants down.
Professor Robert Brooke is an American public health expert who studied Taiwan's response.
They knew everything they had, so they didn't have to scramble. They knew how many hospital beds, how many ventilators, where the equipment like gloves and masks were, how many they had. They were prepared, they had stockpiles, they were ready to, as I would say, rock and roll.
Taiwan's universal healthcare system keeps records on every resident. Marrying that with immigration data made tracing infections much easier.
I tend to believe that we share a lot more data to prevent ourselves from having catastrophic results when something attacks us like a virus.
Some have argued that Asian governments have had it easy because people there are supposedly more obedient.
You think Taiwanese people are more obedient than people in the West?
No, not at all. Taiwanese democracy and Taiwan's opposition is also very critical of the government. But when it comes to public health, when the command center has educated people enough, they understand what is the best for them.
For CBS This Morning, Holly Williams.